My name is Dr. Nuru kaddu MGORI, and I'm employed under the Ministry of Health, Namibia, and the Directorate of Special Program, Oceania Region. And my main responsibility work as a senior clinical mentor in public health settings, where I provide teaching, guidance, side-to-side teaching to healthcare workers in public health settings, mainly at Shakati Hospital, but as well as surrounding primary healthcare facilities in the region, which there are around about 18 facilities within the regions. I also provide multi-regional telephonic mentoring to neighboring regions in matters relating to HIV-related. I was one of the beneficiaries of Merck Foundation, and I completed a postgraduate diploma in Sexual Reproductive Health in March 2022. It was a 12-month, 1-year postgraduate diploma, as I've alluded earlier on, in sexual health and reproductive. The module was more web-based, of which various modules were covered. For example, it was a refresher. The first module was a refresher of the basic anatomy, physiology on sexual reproductive health. Then the second module was more of sexual function. The third module was more of causes of male infertility. And then female infertility was another module. Also, another topic that I enjoyed the most was assisted reproductive technology. And the last one was the ethics around sexual reproductive health. Yeah, so it was more of an interactive platform where we had tutors, professors from different corners of the world with wealth of experience in matters relating to sexual reproductive health. Also, we had fellow learners. Fellow learners, they're also coming from different countries, different races. Some are coming from developed worlds where there is technologically advanced healthcare services, and some of us who are coming from developing countries. So we exchange various experiences and skills in matters relating to sexual reproductive health. So after the course, since March 2022, to be honest, at one point it was not easy a bit, because it was during the pandemic where some of us were actually got sick. And I'm so proud of the Merck Foundation and the office of the First Lady in Namibia. They managed to reach me out to persevere and continue the program. And one of the success stories, after the program, I managed to teach various healthcare workers during various trainings, either on-site trainings on matters relating to sexual reproductive health, as well as the off-site trainings where we call participants, and sexual reproductive health is one of the units that I enjoyed the most in teaching. Also, in providing better quality of care, of which I can testify some of the patients, infertility couple with the infertility issues, they managed to conceive. I can estimate around about 6 to 7, just through basic interventions such as lifestyle modifications, ovulation induction, providing them with appropriate investigation and give appropriate treatment. For example, infectious causes, then you go ahead and provide appropriate treatment. And also I've managed to diagnose certain medical conditions that before the cause, definitely I would miss them. But after the cause, after the empowerment of all the modules, nowadays I'm capable of offering specific investigations that will lead to the appropriate diagnosis. So by saying that, I've managed to diagnose 2 rare conditions that I'm so grateful for this course, because without this course, definitely I was going to miss those conditions. And thereafter, I managed to provide the appropriate treatment as we speak. Some of those patients with reproductive issues have managed to succeed. And I'm so thankful for the mentoring support that I attained during the duration of the modules. It also empowered me with awareness that sexual reproductive health, it is also associated with stigma, intimate partner violence, social exclusions. So with that empowerment, it has helped me to provide a comprehensive care. In particular, a comprehensive care in subpopulation, those who are living with HIV/AIDS, that we have managed to integrate some of the sexual reproductive health component into the care. Definitely, I'm going to refer colleagues, doctors, to participate in this valuable cause. Matters related to infertility with where we are working they are quite limited. Most of the services that are available in private settings, but in public settings, we don't have infertility services. So I understand one of our tertiary hospital, Oshakati Hospital, is also offering infertility services, but mainly to provide basic investigations and addressing the modifiable factors. However, when it comes to technologically advanced interventions such as assisted reproductive therapy or technology, those ones we are not capable of offering it. So those ones we refer them either to Central Windhoek or patient they have to seek public health, private hospital interventions, which is not free. It's quite costly. It ranges around about 3,000 USD up to maybe 6,000 USD for somebody just to try to have a successful offspring or a live birth. So it's quite costly. So definitely I'm going to refer this course to fellow learners, fellow colleagues, so that we should have more experts in this field. Beyond that as well, if we start having this, if we are more experts in this field, definitely it will be easy for us to provide evidence-based fertility services in our clinics. I'm so privileged and honored, so grateful again to the Merck Foundation for assisting me in sponsoring this course, a 12-month course, to make sure that at least I complete the course, regardless of the challenges that we had during that time of COVID-19. I'm also special thanks to the CEO of Merck Foundation Africa, Senator Rasha Kelej for accepting my application, and I managed to receive the sponsorship on that program. Not forgetting also the office of First Lady Monica Goengob to facilitate this training. Thank you very much for that. I remain grateful for the rest of my life.